So the next question is, can men with a pacemaker get an MRI for their prostate?
The general answer historically has been no, that the MRIs and the pacemakers are incompatible. Newer pacemakers are being designed to be able to be used in MRIs, and sometimes older pacemakers can be turned off prior to an MRI. UCLA has been sort of specializing in trying to sift through who can get an MRI and who can't. So the old rule of thumb that if you have a pacemaker you can't do an MRI is no longer true, but you may have to go to a specialty center like UCLA so that they can make adjustments, or sometimes the cardiologist can temporarily turn the pacemaker off, and there are different workarounds that often will enable people to be able to get an MRI.
So that actually leads into our next question. Another patient had a 12-core biopsy with one core being Gleason 9, 2 cores being 7, and then the 2 cores being 6. They're saying they can't do an MRI because of the pacemaker, and they wanted to know if they should considering adding a second-generation anti-androgen, so hormone therapy, or chemo to improve their chance of cure rate.
Yeah, it's the Gleason 9, I think, drives the storyline. It's not whether or not they have the MRI. The thing, of course, now, if possible, is to get one of these new PSMA PET scans, make sure that there's disease, to try and determine if any disease is spread outside the prostate. And that will really be the issue, I think, that drives whether or not someone like this should get hormone therapy, or if they're going to get a long course of hormone therapy versus a short course of hormone therapy. Most people with Gleason 9s are going to get a long course of hormone therapy in conjunction with radiation. The next step is to get a scan, like a PSMA PET scan, which is not a problem with pacemakers. You get a CAT scan and an injection, and there's no problem with pacemakers at all.
Hey everyone, it's me, Alex, and our mascot Hunter. You can check out his Instagram, Sir Hunter the Dow, at the link below. Don't forget to subscribe to our YouTube channel, and in fact, if this dog high-fives me, high-five, high-five. Can you high-five me? Thank you. You have to subscribe. Go subscribe to the YouTube channel. He even thinks that's awesome. Also, don't forget to visit our website, pcri.org.